Okay, let's welcome to the stage from San Francisco, California, Harsh Van Sanem, and his company is Moving Analytics. You ready to go?
Yep.
24 hours. I mean, you can get a lot done.
Good afternoon, everyone. I'm Harsh Vatsangam, the CEO of Moving Analytics. We help hospitals deliver virtual rehab programs for cardiovascular disease. Let me tell you about the problem that we solve. This is Joe. He just had a heart attack. Now, after his discharge, it's really important that he joins a secondary prevention program, such as cardiac rehab, so that he can get back to health. If Joe completes his rehab, he doubles his chance of living another 5 years and cuts his risk of readmissions by a third. But there's a problem. Joe doesn't want to go to rehab, because to do so, he would have to visit a hospital 36 times and take time off from work. Now, Joe's not unique. There are 4.5 million patients like him in the US every year, and less than 15% of them complete their rehab programs. Today, this means that hospitals lose revenue because their patients don't attend. But as hospitals are transitioning to value-based care, where it's required to provide better care to more patients at lower costs, patients like Joe not attending raises the cost of the system. So hospitals have been encouraged by this and are starting to adopt telehealth-based approaches to increase access and improve quality of care. But they lack the expertise and infrastructure to do so. And that's where we come in. At Moving Analytics, we help hospitals deliver virtual rehab programs that their patients can do from the comfort of their homes. There are two things that's special about us. The first is our evidence-based. We're based on MultiFit, a home-based disease management system that was developed at Stanford in partnership with Kaiser Permanente, one of the largest not-for-profit hospitals in the country, and shown to be equivalent to current standard of care. This program is so good that Kaiser is using it not just for treating cardiac patients, but for all chronic disease patients. The second is our platform. We've taken the MultiFit through an exclusive license and then digitized it and made it easy to implement for every hospital in the country. Our platform has been shown to triple participation rates, equivalent clinical outcomes, and based on an economic analysis, we believe that when delivered using our software, cardiac rehab can be a sixth of the cost of what's being done today. So by using our system, hospitals today can earn $4.5 billion in additional revenue and serve new patients. As they transition to value-based care, they can save $5 billion every year. So how does it work for someone like Joe? When Joe's discharged, his nurse creates a customized care plan and then helps him download this plan on a smartphone or tablet. At home, the app guides Joe to really rehab goals, sends him reminders, encourages him, and reports his progress and any issues back to his nurse. Joe's put on a 12-week program, and as part of this program, he has weekly phone calls or video visits. And we make this process easy. Our AI-based algorithms analyze Joe's data and prepare notes for his nurse to make sure that that call goes effectively. Care that's delivered in this fashion is great for someone like Joe because most of it's done at home. It's also been resonating really well with hospitals. Since launching 2 years ago, we're working with over 15 hospitals today, including leading centers like the VA Medical Center, where we've enrolled and graduated over 50 veterans today. Our product has won awards from the American College of Cardiology and the American Heart Association for its impact to cardiovascular health. And this is possible because of our amazing team. My background is I have a PhD in computer science, specializing in AI for chronic disease management. Our clinical team has over 75 years of combined experience in creating and validating disease management programs and are the inventors behind MultiFit. So how do we exactly earn revenue? We charge $300 per patient episode, and in return, a hospital earns $1,000 through reimbursement or saves $2,000 through readmission costs. At our current price point, that gives us access to a $1.3 billion market. And we're currently focusing on those segments where there's incentives for employing telehealth. That includes integrated payer providers, accountable care organizations, and states where there are telehealth-based reimbursements. We get to these customers essentially through content marketing, through webinars, panels, and so on. One of the nice things about this market is that it's extremely sticky with almost 1% churn. So once we get that initial contract, most of our revenues actually kick in years 2 and beyond.
You know what?
That brings us to our customers. Here's a map of all our customers on the East Coast, and you can see that Buffalo is situated at the epicenter of all our sales action, which is why we were interested in 43North. We wanted to use 43North and the resources here to expand our sales, marketing, and customer support teams, and then target those states where we're likely to get the most traction. By doing so, we can get to $1 million in revenue by next year, $5 million, and then $22 million the year after that. But that's not a reason why we want to go to Buffalo. Buffalo's in the top 10% of heart attacks in this country. Statistically, 1 out of 10 people in this audience is going to get a heart attack in Buffalo, and we want to change that. In the next 15 months, we want to enroll additional 1,000 patients by working with payers and providers in this region whom we've already started working with. This will generate $4 million in savings just on those patients. We want to double it and saturate the market every year. By doing so, we also want to expand the state of New York, and that'll give an additional 80 jobs from new care managers and customer support people. There's a lot I can say, but I'd like to end with this thought. A patient like Joe, if he does rehab, doubles his chance of living another 5 years. And I'd like you to think to yourself, what is 5 years worth to you? The birthdays, the anniversaries, the time spent with your loved ones. The shocking fact is that there are 3 million people in the US who don't get that privilege. And by using Buffalo as an example, we want to change that. And we want to show how we can roll it out to the rest of the nation. Thank you. I'm happy to answer any questions. Oops.
Scared me with that, Hart. You going to bring somebody out?
Yeah, I have Chris, who heads our sales efforts, who will also be responsible.
Okay.
Answer any questions.
Who wants to kick us off? Martin, please.
Yeah, can you talk a little bit about kind of the interaction with the patient and, what are the things that the patient is inputting into his or her mobile device on a daily basis?
Yeah, great question. So the things, typically the program is customized to each patient, but it includes a mix of exercise, diet management, medication management, education, and stress management. And if they're a smoker, sometimes you have a smoking cessation program as well. Depending on the patient, you would turn on and turn off different modules, and then the app would essentially take the patient through a curriculum on a weekly basis. Sometimes they have to record their exercise, and if they don't, if there's an issue with accuracy, we give them Fitbits or Apple Watches to do the same thing. And sometimes they can also self-report it as well. There are also various data collection forms that you have to do at different points, questionnaires and surveys to assess the mental health of the patient as well. And the nice thing is we automate all of that. So when a nurse uses our system, he or she doesn't have to remember what to do when. We just tell that person what to do at any given time. Yeah.
Please.
Yes.
But any of those clinical adjustments, you're not doing those. That's being done by the personnel at the hospital. You're a pure SaaS company.
Yeah, so there are two aspects. So there's the actual platform, which a nurse or care manager will use to deliver the care. But then there are AI-based algorithms that were built through validation in Multifit that make that process easy. What we do is usually we say, hey, here's a suggestion for this patient, and then it's up to the nurse or care manager to figure out if that makes sense for this patient or not. So,
Okay, but when you say you, the
Yeah,
software
we're just a
is
SaaS
doing it.
platform,
So you
yes.
are a SaaS.
Yes.
Thank you.
Right, yeah.
Darren.
Good presentation, thank you.
Thank you.
So I Googled the terms cardiac rehab app.
Okay.
And you were first in the results, so that's good news.
Thank you.
Second in the results was a company called Vita Health.
Right.
So, and I assume you're familiar with them, and I'd like you to talk about the competition. And
Sure.
How you're,
yeah. So the
how you
competition could be,
distinguish
without specifically referring to Vita Health, so the competition can be divided into generic patient engagement tools. Vita is one that I've heard of, WellFrame, WellBe, a couple of others. And then another group is basically provider groups that might be implementing native solutions, right? So the way I can tell it from the lens of our customers, what has been useful is essentially our domain expertise, the content, the validation, and they can be guaranteed that even before they start the program, these things are going to work because it's been tested on 70,000 patients. And the other piece with respect to native implementations by hospitals, what's the differentiating factors? We can do it as a fraction of the cost because we're now touching over 500 patients at this point, and we know what works, what doesn't, and so on. So that's kind of how I would, like what we've seen from our customers as to why they
have you compared your efficacy against other apps?
We compare, so typically we compare against baseline. So the two things are, if they don't do rehab, how is their health improving? If they do rehab, and how do we compare there? What we've shown is that our system is equivalent in terms of functional capacity improvement, which is the key metric which you need to do for cardiac rehab, to center-based rehab. But at the same time, it has 3 times higher participation. So at a population level, it makes a huge difference in terms of reducing costs. Yeah.
Can you talk about the license and let us know how a small startup was able to get a license from Stanford and Kaiser?
Yeah, sure. So the licenses, we pay Stanford a $25,000 fixed fee every year, and Stanford has 2% common stock in the company and the right to invest in future rounds. And so we're very lucky that we had a very forward-thinking organization like Stanford partnering with us. I think what really helped was we basically worked with the original team that built these programs, Nancy, Bob, Linda, whom you saw there earlier, saying, hey, we see a tremendous opportunity to take what you've done and put it out there. And so the original team are either full-time or part-time employees in our company, and they were huge advocates for us getting favorable terms so that we could take this out there and make it available.
Do you just have it for cardiac?
No, so the content that we've licensed covers acute myocardial infarction, CABG, smoking cessation, weight management, hypertension, a bunch of chronic diseases, and all of these have been validated to randomized controlled trials, clinical trials. Yeah.
Please.
To the sales gentleman, how do you go about selling this? Who's the decision maker, and how long is your sales cycle?
Yeah, all very good questions. So speaking to the mic here.
Yes, please.
So the market for this is predominantly focused on the providers, the health systems, working with the folks in the cardiac rehab department along with cardiology. The payers are starting to become a more prominent role here for reimbursement. But there's also this ACO environment that's out there where they're interested in these types of options to manage populations in a shared savings model. So predominantly right now we're talking to providers, but I think as we go farther down the road, I think the payers and the folks who reimburse for it are also going to become bigger customers.
And just remind me, who pays that $300 per patient, and how long is it before they get reimbursed? And is that a sticky point in your sales cycle?
Today, it's paid for by the hospital, and they usually pay it as a one-time lump sum. So they say if you're going to buy 100 licenses for $300 each, and we may give them a discount or something, and it's ultimately $25,000 contract. But as soon as the session is completed, they would essentially bill under this code 93797 with a telehealth modifier, and it takes about 90 days to collect that revenue at the end of that.
Got the code.
That's typically how it works. But initially, when we started out, we did have concerns around reimbursement. In fact, that was one of the number one reasons why people would not buy from us. And to that point, we spent the last 6 months studying up coding, billing, and adding those product features in, and focusing strategically on states where there are favorable laws. So instead of having a spray bullets everywhere approach, we just are assess specific regions, we go there. So that's how we do it. Yeah.
One more follow-up, please, Therese. Go ahead.
It's not really a follow-up. I'm just curious to know, you've got a high graduation rate. Who reports? What is the metric for success that is documented to support all the claims that you're making about this app being effective?
The metric for success?
Yeah.
Right. So do you mean what metrics we use to define a successful program?
Right. Yeah.
Okay. So functional capacity, improvement pre and post intervention is a clinical metric.
And the doctors are determining this at the end of your
Yeah. So usually they do it through what's called an exercise treadmill test or 6-minute walk test.
Okay.
And then they do it pre and post the intervention. So in some cases, you may also want to do blood pressure control, weight control, and so on. And then there are also issues related to compliance. So are they complying with their meds and so on?
So
Yeah.
compliance, but what about coming back to the hospital thereafter?
Yeah.
What if they pass your app test for all this
Yeah.
physical test, but then they end up back in the hospital within 30 days? Is that factored in?
In our current models, we are not factoring that in because we make it attendance-based. But down the line, and Chris mentioned this as well, especially when you get into ACO-based models, we want to also start taking risk with these providers and also share in the upside if we prove that we reduce readmissions by 10% or 15% or something like that. So,
Yeah, don't.
Thank you.
Thank you.
Yeah.
I know where you're going. John, please.
When you look at the Buffalo certainly has this problem, huge disproportionate cardiac and stroke risk. So I don't know how this parlays into stroke. When you think of you in this competition and the customers you have you talked to Kaleida? Have you talked to in Buffalo? And
Yeah.
why are they not one of your customers yet?
We just haven't focused on Buffalo until this point. Most of our traction's built in the Philadelphia, New York, and then Midwest, so Milwaukee, Chicago, that region. We want to definitely speak, and I've already spoken with I had some warm introductions through the 43North team, speak to Blue Cross Blue Shield, and I've also separately reached out to Kaleida Health as well, and Buffalo General Medical Center. And so those are definitely things we're proactively reaching out because sales cycles can take 6 to 9 months, and so we want to start kind of hit the ground running as soon as we're in the program. So that's one of the things that we've already started doing for sure.
Please, Mark.
On the reimbursement side again, In order for that to be a reimbursable item, I'm sure there has to be some kind of documentation to show that the patients are actually using it and some reporting that has to be filed.
Right.
Are you generating the reports for those providers, and what happens in the case that patients just aren't following through and using the system, and then it doesn't become reimbursable? Then is the provider at risk?
Yeah. So to answer the second part first, we do have an 80% completion rate, so patients do use it quite a lot. And a part of that is actually a huge amount comes from the original buy-in. When the cardiologist refers the patient to rehab, he or she has to sound excited about this program, and that's a huge part of the compliance aspect, actually. So, and we've identified other tips and tricks to make the patients compliant for sure, and we're continuing to improve on them. With respect to reimbursement, so what is actually reimbursed is the phone call itself in 30 minutes. What are the things you do? Do you do education? Do you listen in or watch them while they're exercising, and so on? So those are the aspects that are reimbursed, and we generate the documentation. So you have basically a drop-down list, which is like patient exercise, 30 minutes, patient did this, and so on. And then I covered these topics and so on. And then the report is generated on a monthly basis, and then you could submit those supporting documentation along with your CMS claim or your insurance claims as well.
Harsh, great job.
Yeah, thank you.
A round of applause.
Pleasure.
Congratulations. Thank you so much.